Carers Week is a national event and 7 charities come together nationally, including our 2 key partners, Carers UK and Carers Trust, every year to galvanise views and opinions and create some kind of awareness around carers issues. And so they've published the report today, and when Adeelah sends out the link, she'll send out the link to the report. But what they've said is 1 in 5 of us are currently a carer. So that means that at the moment we have 73 people on this call. So that means that there are carers on this call. That is other than the 2 carers that are going to talk to us today. And so we all need to remember that as we step through our presentations this morning, that we're actually talking to ourselves, we're talking to allies. The other bit of the fact that's really, really important to remember is that carers take a year or more to identify that they're a carer. And when they do that, predominantly 30% of them do that as a result of talking to a friend. So those of you that aren't carers, talk to other people who you may think are, because it will make a difference to them. Adeelah is going to give us some big picture facts about who carers are in West Sussex and what they're saying currently. So I'm going to just hand over to Adeelah. Thank you.
So as Sonia mentioned, we've been doing obviously a bit of a data dive into understanding who carers are in our county. One of the key indicators that we use is obviously the census results that we have. So based on the census 2021 data, around 8% or just over 72,000 residents in our county are in an unpaid caring role, or were when they completed the census. Most of the unpaid carers are residing in the Arran district, which also echoes our own carer registrations that we have with our organisation too. 60% identify as female and are likely to be aged between 50 to 64 years of age, which means that the majority, so around 71% of carers are of working age. And obviously in the census, 51% were economically active, which excludes full-time students. So that's our range of working carers. In terms of diversity, just over 10% of carers are from ethnically diverse backgrounds, and no surprise, with 2% living in Crawley, which, as we know, is quite a diverse district or borough for us. In terms of comparing between 2021 and 2011, so in 2011 there were 84,395 self-reported carers at the census at that time, and obviously you can see we've dropped down to just over 72,000. That's around a 16% decrease in West Sussex for people self-reporting as unpaid carers. Something to remember, and especially for us as an organisation, we've seen is a high volume of carer registrations taking place since then. Not only registrations, but also the complexity of one-to-one support being needed for unpaid carers, so more challenging situations in terms of their caring role and what they're experiencing. There's lots of different reasons, and I'll obviously share the sort of full bullet points around why there may have been a drop. But obviously it was around COVID, so there were travel guidance at the time to reduce your travel and limiting the number of households you could visit. So for example, a lot of our carers who had shared caring responsibility, say for mum and dad or granddad or even parent carers, maybe only one person was taking on that role. So when they completed the census, which obviously asks you to complete that based on your situation at the time, they may not have put that in. Also, it depends who's completing the census. This was online first due to COVID. So again, just because people have access to a laptop or online forms doesn't always mean it's easy to complete those. And also those who were completing it, are they likely to understand who an unpaid carer is? You know, if you've got your wife looking after you, you may not see them that way. Similarly, if you're a parent carer or you're a parent who's having support from your child or young adult, would you see them as a young adult carer when you were completing the form? Maybe not. So that's the type of things to bear in mind in terms of why the explanation is for the drop in carers, because for us certainly we've definitely seen an increase. So that gives an account from the census data. If you're not already familiar, we obviously did quite a big consultation back in 2020 alongside West Sussex County Council, where we surveyed just over 1,000 carers as part of our strategy engagement. We've now obviously come to the halfway point of our strategy. We're 2.5 years in, so we've gone back out to consult with carers in West Sussex to kind of understand what their feelings are in terms of what's working well, what's not working well, and of course any current challenges they may be experiencing. So we are currently still in the process of doing our consultations. We've completed the online survey alongside a postal survey and had 777 responses. We're currently obviously out and about in the county along with Mark as well and Sonia and other members of our team speaking to carers. We've completed 5 of our face-to-face and online consultations, and we've got a further 2 taking place, including one this week as well. In terms of what carers have told us, the top 3 challenges for carers in our county currently that they're still facing are feelings of stress, having to manage their own physical and mental health, and missing out on socialisation because of their caring role. In terms of what we know is helping them, and we've obviously got Mandy and Nicky, our 2 carers, who are going to talk about that as well. But things that are helping carers to continue in their caring role is emotional support, so whether that's counselling or check-in and chat services, funding to support time out from caring, so this includes carer grants, for examples, and obviously more support for their own mental health as well. So that's the type of things we're hearing from carers about what's working. Obviously, currently we do have the cost of living crisis, and this is one of the questions that we did ask. So of those 700 or so carers, 60% of carers agreed with the statement that the cost of living has had a negative impact on their mental health as a carer. And we've kind of summarised some of the examples that carers shared in the survey about how they've been impacted. This includes having fears of falling into debt, being unable to pay household bills, and obviously we've been very fortunate to pass on some of our grants and household hardship support to carers who need it most. Carers are, in particular working carers, having to take on additional jobs or hours just to increase their income, which of course is impacting their own physical and mental well-being as well, because caring alongside working is a hard thing to juggle anyway, but having to do additional hours and jobs is even more of a challenge. Obviously many carers are also anxious about the future and about affording housing, so having to sell or downsize their homes as well, and many carers are also cutting back on all non-essential spending as well, including on self-care for themselves. Again, that might have been a way for them to have a break or a respite from their caring role, but a lot of carers are having to limit their social or leisure activities outside of their caring role. So that's just a brief example of some of the things that we've been hearing from carers in our county. As I said, we've still got 2 more consultations happening, so once those are completed, we will be able to share the full result of what we know from carers as we come to the halfway point of our strategy. Thank you. So I'll hand back over to Sonia.
Thank you, and I welcome Councillor Bob Lanzer, who is, amongst other roles, he's the chair of the Health and Wellbeing Board for West Sussex that signed off the commitment to carers in 2020. And that was the second carer commitment for West Sussex. And so, Councillor Lanzer, if you're there, there you are.
Good morning, everyone. Thank you for that introduction, Sonia. Thank you for the invitation to speak during Carers Week. I'm the West Sussex County Council Cabinet Member for Public Health and Wellbeing, as well as chairing the...
While everyone's here,
got some interruption going on. So, is that all right? Yeah. I'm also chair the Health and Wellbeing Board for West Sussex, and I want to talk about the joint commitment to family and friend carers 2021 to 2026 that Sonia referred to, and indeed the Health and Wellbeing Board signed that off. I think it was 2021. Now, we worked as well with the NHS West Sussex Clinical Commissioning Group, which has now been succeeded by the Integrated Care Board. And the strategy around support for carers is also a key component of our adult social care strategy called The Life You Want to Lead, which is all about empowering people to make choices about how to live their lives when they need care, the type of care they need and how it might be provided. And all of this remains extremely topical on the national political agenda, because we've seen yet again, unfortunately, a deferral of adult social care reform, but it's still on the political agenda, and surely support for carers must form part of any new adult social care reform. Now, the theme of Carers Week this week is recognising and supporting carers in the community. We in West Sussex County Council have huge respect and admiration for the efforts put in by unpaid carers across the county and indeed nationally. It is estimated at a national level that if there were not unpaid carers, there would be a cost to the public purse of £162 billion, which would be equivalent to setting up a second NHS to service England and Wales, which would be clearly unaffordable. We have a statutory duty to support wellbeing, including that of carers, and we want our whole workforce to be engaged as far as possible in helping with that. One of the challenges we have is that of self-identification of carers. We've seen statistics for those who have identified. It might be that people don't realise they are carers. Just as one small example, if we think of the more formal care system in terms of domiciliary care, care at home, residential care, nursing homes, supported living, if we are undertaking any of the tasks of those parts of the system that I've just mentioned, then we probably are carers, and we should see ourselves in that vein. There might also be an element of the British trait of modesty and also, for that matter, of reticence in coming forward. Maybe we need a little bit of a trend away from reticence and away from modesty in such matters. So, referring to the strategy, we did engage with 1,000 carers and 6 focus groups and 200 stakeholders. And the kind of key commitments that we have in the strategy are really for the greater recognition of carers. So there's more than 31,000 carers registered with carers support. And there's been an increase year on year in registrations, 28%. So we've got good progress being made with about 5,300 new carers registered. And carer registration is fundamental to our ability to support carers in their role. There's also targeted support with the teams of workers located on hospital sites and working with carers to better support them as well, especially during the critical point of a hospital stay. So, and in the last year, 73% of the registered carers reported feeling supported by the carer hospital team. There's also something around equality of access, and in the last year, almost 8% of carers directly supported by carers support were from ethnic minority communities, compared to about 5% in 2021-22. Financial hardship, we saw the figures around the reporting of financial hardship. 77% said the cost of living was a major impact. And although inflation is coming down, certain parts of the inflation indices are still way up there, including those for food. Another point is to reduce the isolation of carers and their emotional stress that they feel. So there have been a range of events. There's been 233 different carer groups events in total. That's a mix of online and face-to-face. The groups were attended over 2,400 times by 859 unique carers. There's another point I want to make about the strategy going forward. I mentioned that we had the clinical commissioning group at the NHS replaced by the Integrated Care Board. There's been a major reform of the NHS throughout England, with the creation of 42 integrated care systems, which bring the NHS, local government and the voluntary community and social enterprise sector together, along with housing, economy, education interests. And the Sussex Integrated Care System has produced an integrated care strategy called Improving Lives Together. And there's a shared delivery plan about how to deliver on those priorities. There are those of us, including Sonia and myself, who have been making representations to ensure that carers receive the appropriate reference and recognition within that planning, which after all, as I said, does involve the NHS, carers support other voluntary sector organisations and local government. So we have a role in local government to advocate for our population in that system, to advocate for our residents, to ensure that carers are not only recognised but receive increasing support, so go far beyond the status quo. Thank you.
Thank you so much, Bob. And I can guarantee that Bob and I on that meeting, which is yet another meeting, but on that meeting we don't exercise light articulation about the needs of West Sussex residents and certainly carers within that. So thank you so much, Bob, for articulating all of that to us about where we're up to with regards to the commitment to carers. And so I'm going to hand over now to Mark, and Mark, who commissions services, supports and innovates actually services and support for carers across the county, and works very, very closely with the charity Carers Support West Sussex. So Mark, over to you.
Thanks, Sonia. Yeah, my name is Mark Greening. I'm as Sonia says, I'm the Commissioner for Carer Support in West Sussex. And why have we got a joint carer strategy, I think, is the starting point. And it's quite simple, really. We need the whole health and social care system to help us in identifying carers and improve their well-being. But just as importantly, I think, is the fact that well-supported carers also enable better outcomes for people with care needs and or patients. So it absolutely is a win-win. Adeelah mentioned the wonderful consultation work that's gone on by Carer Support West Sussex in light of the fact that we are sort of 2 years into our carer strategy. I think we all recognise the world's changed a lot in those 2 years, and you know, in terms of COVID, lockdowns, cost of living crisis, I would suggest possibly another health crisis as a result of some of the lockdown experiences and cost of living. So it is very timely. I think we just do a check-in to see what the priorities and issues are for carers. So Carer Support have already done a consultation targeted at those carers known to them. West Sussex are about to launch a separate one, trying to reach those carers that perhaps we haven't reached before. So there will be posters going out in places like libraries, etc. As I say, we're doing well. 32,000 registered carers out of a potential population of 73,000 is absolutely admirable. But yeah, as ever, we're trying to reach those carers that maybe hitherto haven't come forward to seek their views. There will also be a professional component to this West Sussex carer consultation as well. So there will be some comms alerting to people to the fact that it's it's available and should be available this week in Carers Week, all being well. We're just waiting for the easy read version to be available. There are three main asks, I think, of anyone on this call, and thank you for joining us. One is, yeah, help us to identify carers. As people have already alluded to, many do not sort of self-identify as such. Sometimes it needs a professional to say, you know, Mr. Smith, you do realise you're a carer now as well as a husband. Or so, and I think we have got better at doing that. Absolutely. Involve and include carers. whenever I meet with carers, I'm always struck by they're often more eager to talk about their experience of health and social care generally than the services that we directly commission for them. Their well-being is so entrenched in the service that their loved one is getting or not. Yeah, listen to carers, involve them, see them as partners. They have so much history that can be really helpful, I think. They can also join the dots in terms of professional involvement, because sometimes we just don't always get the full picture of who's involved. And they're particularly helpful, family and friends carers around transition times. Think about hospital discharge. They can play a key role, and certainly they can bear the brunt if we get it wrong. So yeah, identify carers, involve and include them, and of course signpost them for support if required. And if required is important. One carer once said to me, "Never assume we need anything, thank you very much." That'd be really patronising. So some carers, won't need anything, thank you very much. But whenever possible, encourage carers to register with carer support and their GP, even if they're ticking along quite well, because as we know, things change over time, especially. So they're the sort of three asks. As sort of Bob alluded to, we are making some good progress across our 6 priority areas. We've already touched on the fact we've got a good number of carer registrations. I don't think we've mentioned yet that we've got over 400 new carers registering every month, which is unprecedented. Usually pre-COVID, we're looking 200, 250 carers registering every month. We're now looking at 400, sometimes over 450. We think the main driver is cost of living. Maybe there's a good number of carers that have been ticking along relatively okay, but suddenly getting sleepless nights and anxiety and stress arising from cost of living. I think we're getting better at targeting carers. We have got carer support in hospitals. We've got a fantastic carers health team, and that's been recognised by NICE. So if there's a carer that is struggling as a result of their carer burden, their health's affected, we have a nurse-led team that can do short-term interventions purely focusing on the health of the carer. We know many carers are older themselves, may have neglected their own health, not turned up for their own health appointments, or not had their medications reviewed for quite some time. So that we've got that excellent service that, as I say, it's quite a revolution, I think, for some carers saying, "What, you're here to see me? You don't want to talk about, him or her? It's me." Yes, it is, absolutely. Our focus is on you. I'm also, one of our priorities is also to identify and support carers from vulnerable communities. And I'm absolutely delighted to report the Carer Support West Sussex last year were the first carer specialist organisation to receive the Pride in Care Award for their best practice with regard to the LGBTQ+ community. So congratulations to Carer Support on that. And finally, I think there's just one more plea, because I'm conscious of time. Contingency planning. So one of the asks this week in Carers Week is, do the carers you work with have a plan B? Can you ask carers, should anything happen to you, you've suddenly fall ill, God forbid, have an accident, do you have a plan? If they have, if it's, my neighbour, my friend or whatever, do those people know they're actually part of a plan? And as we know, some carers won't have the luxury of neighbours, friends or family they can call on. So we do have a carers emergency contact card scheme, and also a carers emergency respite scheme. So if you're interested in finding out more about the carer emergency contact card, if it's something you've not heard about, there are details on the Carer Support West Sussex website. I could go on for longer about some of the achievements, but I think I'll leave it for there because I'm conscious there's other speakers. Thank you, Sonia.
Thank you so much, Mark, and I think my job will be to remind you about that fourth ask at the end, which is really important in terms of contingency planning. Nicky, I'm just going to warm you up and remind you that you're just about to speak. Nicky is Sarah, and I'm going to let her introduce herself, but what I'm going to remind you is that behind all those numbers and those statistics are people. And what we wanted to do was just to bring in a couple of those stories and those experiences so that we can remind ourselves just talking about. So Nicky, thank you so much for being so generous with sharing your experiences. Over to you.
Thank you very much, Sonia. Hello, everybody. I'm sure that Mark, I know, heard me the other week when we were talking. I'm a carer. My husband has multiple sclerosis, and he's had that for over 30 years now, which means that I also have been a carer for over 30 years. And just to, I'm just listening to Mark earlier, do you know I didn't recognise I was a carer? It never ever crossed my mind until, in fact, I came to get the job with Carer Support. I worked for Carer Support for quite a few years. And what I do want to say is that there is a certain stigma attached with being a carer. And I think that was certainly applicable to me. And I think some of that was part of stigma, part of my own thoughts about where I should be, who I should be, and I think that's really important. So I think that's something that I would like to just mention. I was saying when we spoke last time about how COVID had really affected me, and I'm sure it affected lots and lots of carers, because COVID made me feel rather invisible. And I'm sure there's lots of carers out there who are still feeling exactly the same. The impetus was very much on the NHS. I felt I was still working for Carer Support at that time, and it really did almost drive me completely under the ground, because just the stress on me of looking after my husband as well was so horrendous. So yes, there was a certain amount of bitterness, I suppose, about always not being recognised as a carer for what we do, for the fact that actually I was keeping my husband out of hospital. There were a couple of times when I did have to take my husband to A&E, very reluctantly, because we had quite a lot of trouble with UTIs, and that's still an ongoing crisis. It goes on. And the fact that when you go to hospital, that you're not felt listened to as a carer is so awful. I actually made my own referral on behalf of my husband with the incontinence team at the hospital. And when we turned up for the appointment that we had received from the consultant, I was told that I was not allowed to go in with him to see the consultant. And that was absolutely disastrous. One, because I actually was the person who had made the referral. I was actually the person that knew the background to the whole thing. Two, because what happened was by refusing to see me, they didn't hear the full story, and it ended up with my husband being dismissed or discharged from the incontinence service. The knock-on effect of that, if we get a knock on the door, it might be, is a huge emotional toll for me, a huge financial toll, in that I'm currently spending over £80 a month on incontinence products, which was something that could have been so nearly completely avoided had I been listened to. So there's a huge knock on there. And the other knock-on is that I have referred back now to the incontinence service, one in Chapel Street. So it's just complicating the whole of the NHS, when if only somebody had listened to me properly in the first point of call, it would not have happened at all. So that's a big thing that I want to say. I also wanted to talk about, I'm sorry if I'm going to go on and you're going to have to cut me short if I do, is the complexity of our neurological services and of the NHS and where they are geographically. So I know that we're talking now as part of West Sussex. It so happens that during COVID, my husband's actual neurologist, we weren't told, nobody was told, only found out a few months ago, a couple of months ago, our neurologist had actually moved on. So in fact, my husband now has no neurologist. But what has happened is that some people have gone into the Isle of Wight for services, and some people have gone to Southampton for services, because it is quite a specialist area, the whole of neurology. So that there's been really bad communication. The things that I know, I'm telling you because I have found out, because I'm quite proactive. I'm actually an advocate for the MS Society for this area. But you know, these things, even me with my what I think is knowledge that I have, it's not enough. And there'll be so many other, if I don't know this, then 99% of other people in my my situation would also not know this, Sonia. So yes, the thing that has kept me going, because I as a professional, I was also a counsellor, I'm very aware of my own need for my own emotional and physical health. And so with my Carers Wellbeing Fund, which is the grant that I apply for every year from Carer Support, that goes towards my gym membership. And I'm not a gym bunny, but it's something that is just so important to me. And I will go 4 times a week, at least, probably, during a time that I can do that without affecting my husband. And it does keep me going emotionally, keeps me going physically. I have to say as well that I have met so many other people by talking to them at the gym and recognising that they are carers. And I really do spread the word. I recognise their need for the release that they get from the gym, what it does for them emotionally. And I think it's just important to spread the word wherever we can. So that's, yeah.
Thank you so much.
Oh, Nicky, thank you so much. And, you know, you probably couldn't see, Nicky, but the people were nodding and, yes, sending you hearts, I think, and hugs, basically. And thank you so much for sharing that and for sharing that story. And moving on to you, Jane, your work is around engaging with people and hearing from them. Are you all warmed up, Jane? Yes. So, yeah. So yeah. Jane is employed by NHS Sussex, which is also known as the Integrated Care System or Board. And works for and with health and care across Sussex, and works for and with people to actually take their views to the system. So moving on to Jane, thank you.
Thank you so much, Sonia. And I'm starting to think, goodness, how can I possibly follow Nicky? But I will do my best. All credit to Nicky. So as Sonia said, I work for NHS Sussex. And my job is exactly as Sonia described. It's making sure that we reach and hear from people and making sure their views and experiences have impact. And just before I plunge in as well, I would say I'm also a carer. I'm a carer for my elderly mum, and we're a caring family because my husband also cares for his elderly mum and his brother. So we do know all about carers, and I have a lot of empathy with some of the insight that I actually hear from carers. May I have the next slide, please, Adeelah? So I'm just going to talk, and I won't talk about every single part of this because people will be able to hopefully see it afterwards. But in NHS Sussex and the organisations that have gone beforehand, we've worked with Carer Support West Sussex and other care organisations for some years to make sure we reach and hear from carers. And that might be something we organise ourselves, or it might be working with carer support. So, for example, the carer consultation work that Mark was outlining before, that we would ask to share some of the insight there. I think one of the things I hear quite a lot is, please don't different organisations keep asking us separately. So it's really important we do link up, talk to each other to understand views and experiences. So from an NHS point of view, why it's important is it helps us make changes to services and ways of working. We understand where it's not working. I mean, Nicky, what you said about that incontinence service, I almost had to go off camera and let off steam in a little volcano-like way because that made me really cross. But it's only when you hear things like that you sort of think, right, that shouldn't happen. I mean, I'm really sorry it happened, and we can do something to actually make sure it doesn't happen to somebody else. It's kind of the ongoing discussions with carers as well, because I know that some carers, it's all that they can do to actually fill in a survey or talk to us, because carer roles can be so pressured. But sometimes carers will work with us over a period of time to discuss changes, to make sure that the changes are having the right impact on carers. Because I think that's the other thing, you can change something, but how do you know you've done the right thing and you're doing the job you wanted to do? But thirdly, working together with carers as partners, which again was something that Mark talked about, working together with carers to build in carer voice. So it's not enough a lot of the time to just say, thank you very much for filling in that survey, I'm going to take that away. But we need to work with carers as our partners and make sure that that's embedded in something called co-design or co-production. May I have the next slide, please, Adeelah? So how did I was asked to talk about how carers are supporting the NHS, and I don't think there are enough words and certainly enough time to do this justice, but this is the recent King's Fund report that unpaid carers provide significant levels of support to family and friends, equivalent to 4 million paid care workers. So what carers do, what family and friend carers do, is amazing, not just for their loved ones, but actually supporting the NHS and supporting the health and care system. And the ways that carers support are obviously telling us about the needs of the person they care for. And I'm sorry to keep going back to what Nicky said, but actually, Nicky, you could have been in there with that appointment with your husband. You could have told the consultant about what your husband's needs are, experiences are, and advocated for your husband. I'm sure that's the same for other carers who are on this webinar, working with us to support the person they care for in the most effective way. I, as a carer, can tell services all about my mum, and I wouldn't expect the GP practice or the hospital to know about my mum. So let's work together to support my mum, but also supporting a health and care system that is really challenged. And you know that, we had COVID. You will have seen in the press about workforce challenges, busyness. You will know how hard it is to get an appointment sometimes. So actually, carers play an amazing role in supporting that health and care system that is really challenged in many different ways. But we can do so much more to work with, involve and support carers and respond to your knowledge and your expertise, which is, I think, at the heart of the work I do or try to do with Sonia and the rest of the team. May I have the next slide, please, Adeelah? So just a few examples of where it is shaping work. And I think Mark mentioned improving discharge processes. They're still not great. I hold my hands up and say that, but there have been improvements. Improvements in GP practices, involved in new initiatives, including something called virtual wards. Let's call it hospital at home. That's probably a bad phrase, but I'm sure Sonia and I could talk at length about that. But carers have been absolutely intrinsic to developing that. Making sure our communications are right, that they're going to hit the spot for carers. And in fact, we work with Carer Support West Sussex and other care organisations to do some work, and they designed the communications to make sure they're carer friendly. which had an enormous positive impact in a range of ways. Advising us about communication to patients when they have accessibility needs. Many carers support people with learning disabilities, with sensory impairments, and sometimes we need that help to actually say to the NHS to say, you know, if you do it this way, our loved ones won't be the right way. So helping advise us on how to frame those communications. And also, as Mark said, I think helping think about the needs of diverse carers. So some of the carers from our ethnically diverse communities and LGBTQ+ carers who still carers but might need to think about slightly different perspectives. So all of those are ways that we are using insight and experience to shape health and care services. Have the next one, please, Adeelah. So I guess finally from me, it's thank you. It's thank you to everything that carers do for the NHS. Thank you to everything that Carers Support West Sussex does and other carers organisations in supporting carers, so they in turn can support the NHS. But also, you know, it's about acknowledging everybody for their generosity in sharing their views and their experiences. Some of those are quite hard to hear because they just shouldn't happen. But it's only by actually sharing those views and experiences with the NHS that we can make the changes that you need to be able to support your loved ones and also to support you as a carer. Thank you. And hope I'm within time.
Thank you so much, Jane. That was, yeah. Jane's getting a gold star for that then. Thank you. And moving on to Mandy. And so I will let you get warm, Mandy, and sort of do your throat exercises while I sort of introduce you, Mandy. And the way in which I want to introduce you is just to say that also you're generously giving your time and experience as a carer today, but also as a volunteer for Carers Support West Sussex. And I just want to remind everybody, it is Volunteers Week as well as Carers Week. I mentioned earlier on that I think now, because there are only 52 weeks in the year, unless we can iron the year, everybody is jockeying for position for Awareness Weeks now. So we've got a double up this year. And just to say that there are 4,500 voluntary community organisations in West Sussex. Doesn't that make you proud? And actually, a lot of those charities, some of whom are represented here today, a lot of those charities depend upon volunteers. They don't have any paid members of staff. And at the very, very minimum, the trustees, the people that make decisions about the whole shooting match, are also volunteers. So I welcome Mandy, not just in terms of sharing with us her story, but because she is one of those wonderful people in West Sussex that step forward and give their time to support other people. So Mandy, over to you.
Just need a moment.
Sorry, Mandy, did I not give you enough? Okay, are you and Mandy?
I'm okay. Thank you very much for that.
Take a big deep breath.
Yeah.
Thank you, Mandy.
Yes, I mean, basically to end, I can't. Every word that's been spoken up until now is a mirror of what anything I have to say. And there's a lot of comfort to be taken from being a carer, hearing other people, or rather sensing other people that really get it. Nicky, you know, Jane, probably all of you. Just knowing that other people, listening to what other people are saying and feeling that sense of comfort that you're not mad, you're not on your own. So weirdly enough, carer support became my silver lining out of what was a really dire situation for me. And I went from feeling hopeless and helpless probably 2 years ago to now feeling hopeful and helpful. And I didn't see that coming. I didn't realise, as far as being a volunteer went, that was a two-way exchange, and I'm very grateful for it. And I couldn't not pay forward what I've been on the receiving end of. I became a carer for my mum, a full-time carer, in as much as I had to give up my job during lockdown to look after my mum, who I'd already been caring for, but working full-time as well. The situation was desperate because of lockdown. She has Alzheimer's and dementia. I cashed in my pension, took out the lump that I but lockdown happened, and that, what ordinarily I imagined would take 6 months to a year, is we're now like 4 years in. She doesn't now live with me. She now lives next door to me in a sheltered accommodation place, which has taken the pressure off immensely. After 3.5 years of having social services eventually involved, she now has carers going in 3 times a day. But that's been, as Nicky will know, that's been a challenge because it's been so inconsistent. I've still needed to be heavily involved. Being a full-time carer for my mum has impacted me in the same way it's impacted everybody else, in ways that you can't even imagine. If somebody was telling me my story, I know I would struggle to believe it. And I don't say that easily, but I wouldn't believe my story if I was talking. Yeah, it's an unbelievable experience, and the struggle is real. It is emotional, it is mental, it's physical, it's financial, it turns your world up. In my experience of becoming a carer turned my world upside down and inside out. And reaching out to carer support, which took me a long time to do because I wasn't aware of them. I had my closest friend in Somerset had a relative that worked for carer support, and they passed that information on to me. And that's when I went from feeling hopeless and helpless to hopeful and helpful, because I was out of everything. I was out of money, I was out of finance, emotions, physical. And from that phone call on, everything started to change. Somebody somewhere was holding my hand with the check-in and calls, which is what I now do as a volunteer. Somebody phoning in and checking in on me, giving me advice on who to speak to. So I had help with the fight. One of the biggest things that I struggled with was finding myself financially in the position that I was in. And I've got 7 grandchildren, as happy as they are just to go down the park and have a walk, which we do regularly. One of the things that I used to do with all of them was we'd go to the theatre once a year, and I wasn't able to do that anymore. And then carer support told me about the hardship fund, I think that's what it's called, and I was able to take my grandchildren to the theatre, which made, I can't tell you what a difference that made. I don't think I'm ever going to be able to tell you what a difference carer support has made to my life. And I can't not be involved with them as a result of that. It's an absolutely necessary service for people, and I'm very grateful to have had it, and I'm very grateful to be passing some of that forward.
Mandy, you know what, I can tell you on behalf of everybody on this call right now, you don't actually need to say. We can see it and we can all feel it. And there are so many people are struggling to even not get out their tissues right now. So thank you, Mandy, for that, because that was incredibly genuine and emotional, and we all wish that we could nip into your kitchen right now and make you a cup of tea and give you a hug, because it feels that that is what you need right now. But so thank you so much. One of the things that we have done together, Mark, with the County Council and with colleagues, and you and I have championed this particularly around the hardship fund, is we've managed to give out in the last financial year nearly 1.3 million in grants to unpaid carers in this county. And that is a huge figure when you think of it being 200 or 300 or 400 pounds. That's a lot of people. It's a lot of people. Somebody on the call will remind me, but I think it's about 3,300 carers. But what we think about all the time, and this is what our teams of staff and volunteers do, is they hear and work with carers with your kind of story, Mandy. And I am absolutely clear that it's hard work for everybody, for carers, for staff, for volunteers. But, you know, a wise man once said to me, hard work, but good work. And I think that we are very, very, very privileged to be doing that good work together. So thank you so much, Mandy, for sharing your experiences. Lucy. Lucy's going to talk about contingency planning, but Lucy, I think we need to give Lucy again a bit of a moment, because I know, Lucy, that it's really, really hard, isn't it, as a team member in this charity. It's hard for our health colleagues, it's hard for our charity colleagues, it's hard for social work colleagues to be working in this environment at the moment, where we automatically go into these jobs to fix. We want to make things better for people. That tends to be why we're doing the work that we do. And I know it's hard at the moment because there's an awful lot that can't be fixed. But one of the things that you will talk to us about is that plan B and the importance of having that contingency plan. So over to you, Lucy. Thank you.
Thanks. Hi, my name's Lucy. I'm hoping that Yvonne is also on the call. I haven't seen her pop up, but she did say to me she was going to join. She's come from TuVida, and once I've gone through my bit about contingency planning, I'm hoping that she'll be able to share a story where they've been able to help a carer. Mandy, I don't know how, I feel like I've got a real lump in my throat and I'm going to find it difficult now to kind of get my train of thought, but you're doing an amazing job and you should be super proud of yourself, and so should Nicky as well, for everything that you do. So yeah, I'm going to talk a little bit about contingency planning, how it links in with the carer emergency contact card that I look after, along with the carer discount card, but I'm going to be talking about the emergency card, as Mark touched on a little bit at the end of his talk earlier today. So contingency planning is obviously making sure that you have a plan in place if anything was to happen to you, obviously any kind of emergency, and that you have peace of mind to know that obviously the things will you know, be put in place basically if something was to happen to you. Some things, it doesn't necessarily have to be that you might fall ill as a carer, or you know, have a sudden emergency. It could be that there might be a domestic emergency, a fire or a flood in your home, things that you might not necessarily always think of. You know, we don't like to think about the bad things, we just tend to just always think about the good things and keep going with those. So it could also be like in a family emergency, so it could be that you might not care for a relative, but something happens to a relative and you need to go off and deal with that, or you've got children that you also care for, and one of those is taken ill. breakdown in care arrangements that you've already had. That could be another thing that might happen, or an unexpected work-related situation which you might need to go for, or if you're staying away somewhere, and as we all know, the trains have been cancelled, and it could be something along those lines, and that you'd need to make a plan, obviously, if one of those situations happened and the person that you're caring for is at home and you're not able to get there. So contingency planning can link in with the emergency contact card, which I'll talk about in a minute, but it's basically just ensuring that you have a couple of contacts that are aware that you're going to use them, and have their details and a plan in place, so that if anything was to happen, those people could come in and step in and take your place if need be. Obviously, those people that you're going to use as an emergency contact need to be aware that they're happy to do that, and they need to be aware of the contingency plan, and know all the details, etc., of what needs to be happening when they step into that place. Also, that those people are also happy to share their details with professionals, because we may need to share with professionals those details, and that they're happy to do that. So we would suggest to fill out a contingency plan on a form. There is one on our website on Carer Support West Sussex under resources. There's a contingency plan on there. You can download that form and fill that out. Keep it somewhere safe. Make sure the emergency contacts that you have put on there are aware of where you're keeping it, and give them a copy as well. Maybe inform your GP that you are a carer if you haven't already done so, just so that if anything was to happen to you, and the GPs are aware, they also obviously know that you're registered as a carer. Give the completed copies of the forms to the people and your trusted emergency contacts, and again, have a copy to hand somewhere. And please make sure that the emergency plan is updated, because obviously if it's not updated and the people are incorrect, it's not going to work. These are the, I don't know if you can see, but that's an emergency contact card. That's what it looks like. That's what a carer would get. So they would get something that looks like this. And on the reverse, it's got a carer discount card. So they're the new style cards that we have. Carers can register through our website. They can contact us. We'd get them to fill out a small form. And then what would happen is we would register that with PPP Taking Care, who would log all the emergency contacts on the form. And then obviously if something was to happen to the carer and they were carrying their card, the emergency services or whoever they've been picked up by would contact that number to obviously let them know that they're a carer and that somebody's needing care at home. We would, if obviously none of the emergency contacts were in touch, or they needed emergency respite, then TuVida could come in and they would obviously provide emergency respite for that the person they care for. I don't know if Yvonne is on the call, and if she can say if she is or not. If not, I can carry on her behalf.
Yes, I'm here, Lucy. Sorry, I was on mute.
Oh, that's okay. Hi, Yvonne.
Hello.
So I don't know if Yvonne just wants to give a little bit about what TuVida do in forms of emergency respite for carers, and also she had a lovely little story about Derek, who obviously they were able to help with. So I don't know if you wanted to take over, Yvonne.
Yeah, no, that's fine. So like Lucy was saying, once you're registered with us, it's a free service because for the carer, because it's subsidised by West Sussex. So then we would come out and support for up to 48 hours if their emergency details people aren't available. If it happened, say, for instance, on a Friday evening, we would then support through to the Monday. But on the whole, it's usually 48 hours. But we would communicate with the emergency contacts to see what we can share support with, or if they can help at all. We would just get the bigger picture, and we just chat with them and then take it from there. So I'll talk to you a little bit about a carer who called us one day, who was taken in poorly and then taken into hospital. And her husband, Derek, was at home. He had been diabetic for many years, and his eyesight was really failing badly. He couldn't drive anymore. He couldn't support his hobbies. He couldn't see to make himself a drink or anything to eat. So we went in and we supported whilst she was admitted to hospital. And we got chatting to him, and one of the carers that was supporting him during the emergency had an allotment, and that was her hobby. And it was his hobby. He had an allotment, and he was saying that he's going to have to give it up because he can't see to plant his seeds or do anything that he used to do. He couldn't drive to the allotment, which was 2 miles away. And he's had his allotment from when they first got married in his early 20s, all these years. And he was devastated to have to give it all up. So when his carer came out of hospital, we made contact and we registered them for the subsidised core service, and we supported with the carer who has an allotment as well, because they had something in common. And we've been supporting there now for more than 2 years, twice a week, for 3 hours each visit. And she picks him up and she takes him to the allotment, and they plant their seeds and they grow their vegetables and they reap their rewards. And he's given leeks to us and all sorts. And we've got photographs of them growing their produce together. And it's just such a lovely, lovely story. He's totally blind now, but yeah, still really enjoying his hobby. So what started from just registering for the emergency respite service has now sort of ended in having regular support through the subsidised rate, and he's still enjoying his hobby.
That's good. And it also means that Derek's wife can continue to get better, and obviously gives her that respite as a carer, you know, to not feel pressured into jumping straight back into caring and possibly being admitted back into hospital again quite quickly. So yeah, it's fantastic service. The emergency contact card, I forgot to say, that is with us. If carers register, it's valid for 3 years. So and then what will happen is we'd write to you, let you know, or you can contact us if any details change and stuff. So yeah, did you have anything else you wanted to say, Yvonne?
I think it's really important as well, if there's any changes, that they do contact us. We've had a few occasions where people have moved, so the risk assessment of the environment and the car details in case the carer was taken poorly and they were out in the car, maybe in the supermarket car park, and the carer for maybe sitting in that car, the carer gets taken poorly. All our details have changed because they haven't updated it, and it makes it really difficult. If, you know, one occasion somebody called us and they'd actually moved out of the county but still had the card, still rang us for support. And it's you know, it's really difficult when we can't support and we know somebody's in need, but there's a reason why they can't.
Thank you so much. Thank you, Yvonne. It's like the plea to keep things updated. Yeah. Oh wow, what an amazing webinar. I just want to say I think it's an amazing webinar, and so I want to thank the team again for putting that together. Thank you so much, and we will send some links out for the contingency planning as well, Lucy, so that we have got that in that email that Adeelah sends, so that you can make sure, especially if you're working with carers, that you have that conversation around that plan B. Because remember, it was one of Mark's 4 asks that he gave. The other strong one was around carer identification. And just remember how invisible and how much it touched you, how invisible Nicky felt. And so I want to remind you all, 1 in 5 of us on this call at the moment will be carers, but 4 out of 5 of us won't. And so please take away nothing to make sure that others don't feel invisible, whether it's in your work, whether it's in your social life, whether it's your next door neighbour. Also remember how touched we all were by Mandy's experience and her generosity in sharing. And, you know, let's take that responsibility of that and, you know, respect the fact that at some point carers do feel hopeless and helpless. Not all the time. and not every day and not every minute, but there is a possibility for some people that they can become hopeful and helpful. And that is actually really, really strong, positive message to take forward. And thank you finally to Yvonne, because let's hear it for the leeks, because I love a story that ends up with produce. You know, especially when the produce isn't meat, is all I'm saying. But thank you so much, and thank you for your attention. And you know, if you can, just rub your heart, because I know it might have hurt a little bit during this last hour. So just rub your heart, give yourself a hug, stand up, turn around, go out in the sunshine, and remember that you know, we want to thank, all of us on this call want to thank carers for everything that they have done, everything that they are doing, and everything that they will do. Thank you so much. Bye, everybody.